Welcome to Independent Sage. It's Friday, the 4th of September. I'm Alice Roberts. This week we'll be talking about schools, and we've had so many questions and comments coming in from the public, lots of comments coming in via Twitter, lots of concern about what should and shouldn't be happening in school, and lots of strong feelings as well. And to start us off, Professor Christina Pargell is going to do a summary of the statistics and test and trace report. But I should also actually mention that we have a new universities report, which is up on our website as well. But yes, I shall now hand over to Christina.
Thank you. Let me just share my screen. So I hope everyone can see that. So welcome to today's briefing. I'm going to try and keep it quite short so we have lots of time to talk about schools. So today I'm just using data from the government's daily figures and their report on test and trace. And then going to go through just the number of new cases in the UK, something on test and trace, look very briefly at the international context, and then finish just with thinking about schools. So the headlines, just to kind of tell you what's coming, is deaths are declining and hospital admissions continue to plateau. So they're not going down anymore, but they are at a very low level. So I'm not actually going to show that data. A number of daily cases are rising. Positivity rates are going up, but slowly. And just again, like the test and trace system really does need urgent improvement, and particularly to support schools reopening now across the UK. So this is the number of new confirmed cases. So this is people who've had a positive test in the UK. You can see it has been going up pretty steadily since July. We had over 1,700 confirmed cases yesterday, which is the most that we've had, well, since the beginning of June, compared to, we were in the mid 500s at the beginning of July. So the question is, we know that confirmed cases are going up, but how much of that is because we're testing more people? And that's when you look at what's called the positivity rate, which is the proportion of people who you test who then test positive. And if your cases are only going up because you're testing more people, you'd expect your positivity rate to stay the same. And so that's what we're going to look at. And this comes for England from the NHS Test and Trace report, and it's a weekly measure. And they split it up into pillar 1, which is tests done in hospitals. So that's new patients and also hospital staff. And that's this orange line. So that's actually been going down between June and July, and then it's been very stable since July. It's low and steady. In the community, which is pillar 2 test, so that's people like you and me, if we get symptoms and go and get a test, the positivity rate has been going up, a bit erratically, but going up since July, and it's now currently at almost 2%. And what you can see is that we are testing a lot more people. So we're testing almost 100,000 more people a week than we were, but cases have also doubled. So we actually, what you can see is that the number of people tested has gone up by about 50%, but the number of positive cases has gone up by almost 100%. So about half of the increase in cases that we're seeing is due to more testing, which is a good thing, but half of it is due to more infection. I've also found this very helpful website which keeps track of all Scottish data, and they also have a positivity chart, which I thought would be interesting to look at because we know that Scotland has been seeing more cases over the last month. Now this combines community and hospital tests into a single measure, but you can see that in July they were very, very low. They were at 0.3% positivity rate, and in England we've never got below 1%. So they were in a very good position in July. Then there was quite a rapid increase towards the end of July, where there does seem to be the positivity rate went up. So that is, more transmission likely linked to the Aberdeen cluster that they had. But since over August, it's been pretty stable. And so the case increases that we've seen in the numbers in Scotland over the last few weeks is likely due to more testing and not more transmission. Test and trace metrics, pretty much, it's just not getting any better. It's just the same as it's been ever since the beginning in May. I don't really know now what's happening now that Public Health England is being dismantled and what they said they were shaking up, test and trace. I don't really know what's happening, but it's not improving. The last week of August, which is the last set data, 7,500 people were referred to test and trace. So that's new cases. Only 65% of them gave at least one contact. And of those contacts, non-complex contacts, only 60% were reached. And basically that's just not good enough. And what's more concerning now as well is that at the beginning of this whole process, which is getting tested, there seems to be an issue. So there are increasing reports that it's really hard now to get a test. People are being asked to travel sometimes hundreds of miles to get tested, and home tests seem to be in scarce supply. So that is worrying, and it's particularly relevant this week because, there was a Lancet paper a few weeks ago really highlighting that testing and tracing is key to schools returning safely. On the international front, I guess everyone knows that Europe is experiencing new spikes, particularly Spain and France, seeing a lot of new cases. The UK is doing pretty well compared to mainland Europe. So, that is a good thing. Our cases are going up, but they're going up much more slowly. Germany and Italy are also going up, but are still at relatively low levels. And just to say that although we're not seeing any increases in hospitalizations, both Spain and France are now seeing increases in hospitalizations. So we do really want to avoid ending up in that situation. And what's also just thought would be helpful to give an overview is just look at some international examples of prevention measures in schools there. This is by no means exhaustive. This is just kind of what I managed to find over the last couple of days. So in terms of going back, most countries are sending children back to school, but not everyone. Some hard-hit areas in the States are starting off only virtual. Some schools in France aren't going back where there's a high risk of transmission. And Madrid, which is in one of the hardest hit areas in Spain, is having a mix of online and in-class teaching. There seems to be kind of quite widespread use of face coverings in schools. Japan, Spain, and South Korea are mandating them for both primary and secondary schools. And in South Korea, actually, the government is providing face masks for all students. For just secondary schools, France mandates it, and that includes teachers, Belgium and Germany. In Germany, but they're saying you don't have to wear a mask once you're actually sitting in the classroom. Other kind of mitigation measures, many countries, South Korea, Spain, Norway, are really trying to space seating in classrooms. Spain's even trying to find new venues where they can put students and try to hire more teachers so they can have smaller class sizes. In terms of like ventilation policy, Japan has a kind of distinct policy of trying to open windows and doors wherever possible. And many countries like France, Germany, Spain, Norway are all doing bubbles of children. So that's partly trying to reduce transmission by keeping children in quite distinct cohorts, but it also means that if there is a case, that it means that fewer people have to self-isolate. And Germany, Spain, and Norway are also really having real efforts to encourage frequent hand washing or hand sanitizing during the school day. And just finally, in terms of support for children with virtual learning, so like providing laptops, Paris is now providing free laptops to all students. There are calls in Spain for the Spanish government to do the same for children there. So just to summarize, and I've said this already about deaths and hospitalizations, we've kind of gone from 500 daily confirmed cases 6-7 weeks ago to over 1,500 a day now. And about half of this is due to more testing, but the rest is kind of more infections. And it's been really slow. And I kind of feel like it's good that it's slow, but on the other hand, I think it means that we kind of get used to it. We kind of used to, now it's used to being over 1,000, and soon we'll be used to it being over 1,500, and maybe in a week or two we'll be used to it being over 2,000. And I think we shouldn't become complacent. We shouldn't be like, oh, this is okay. I don't think it is okay. I think we do need to try and drive it down. Positivity rates are going up. And again, the test and trace system, it really does need to improve. And especially now that there are problems getting tested, and now that children are going back to school and there will be symptoms that are compatible with COVID, that means more people will need tests. We really have to sort this out quite quickly. And just to kind of finish, other countries have opened up schools earlier than us, including Scotland, us in this case, sorry, it's England, Wales and Northern Ireland. And as schools now open in the other UK nations, we can and we should learn from the experience of others. And now we'll hand over to think particularly about what we can learn from Scotland. So I'll just switch PowerPoint.
Christina, are you going to continue presenting, or is Susan?
No, this is now going to give it over to Susan.
Okay, so Professor Susan Mickey is going to take over presenting now. Susan.
Thank you. Schools in Scotland have been open for almost 3 weeks now, so we thought it would be a good opportunity to learn from their experience. And we, on the basis of what we've learnt, have suggesting a 6-point programme of action for all schools to consider. Next. So the lessons from Scotland, the good news is that there's little evidence of the infection rate in children rising. And at the end of the second week, there were infections in 53 schools, and this was mainly in teachers and mainly brought into schools from the community. But there is beginning to emerge some evidence of transmission within schools. And the other issue is that there are very large numbers of both staff and children having to self-isolate. So just looking at the difference between week 1 and week 2, for children it went from 5,857 right up to 19,533. And obviously that is quite a disruption for children's education as well as families. What has also emerged is that there are real problems of social distancing or distancing and ventilation in classrooms. And this is very concerning, given that we know 2 of the key things for reducing transmission are having adequate distancing between people, especially as in school children. Children are coming across many different people during the day for many hours at a time. And we also know that ventilation is key. The vast majority of transmissions, especially of super spreader kind of events, have been outdoors. Very few, have been indoors. Very few happen outdoors. And the final concern is, as has previously said, the testing system is under considerable strain. And the test, trace and isolate system is absolutely key to ensure that outbreaks which will inevitably occur in both school and also university settings are jumped on and dealt with very quickly, so they don't transmit into many higher numbers. So the first 3 points of our 6-point action plan, firstly, to drive community transmission down. It's obvious from the Scottish experience and also from other studies that this is key. In order to do this, we need to support people to be able to carry on working at home where that's possible. We need to ensure that workplaces and public spaces are COVID safe. And we produced a report last week on how to ensure workplaces are COVID safe. I'd commend that to you. And also to consider closing some of the high risk indoor spaces. We've seen outbreaks, Aberdeen was mentioned previously, in pubs and bars, which are high risk spaces. So where people tend to be crowded indoors, and especially where alcohol is consumed, the social distancing is a problem. Secondly, a widespread information campaign to support COVID safe practices at home. We're not getting consistent messages, and we need to keep reiterating about how this virus spreads. It's partly aerosol, but partly the idea is it comes through surfaces. So people need to keep hands clean, not touch eyes, nose and mouth, which is where the virus gets into the body, and use tissues for coughs and sneezes and dispose of them appropriately. We need to, thirdly, provide resources to allow smaller socially distanced classes, and that may require asking, say, previously retired teachers to come back, so we have a larger staffing to support this, and also having other venues in terms of unoccupied workplaces, hotel, meeting rooms, community spaces, etc. Monitor both distancing and ventilation in schools. We know that this is a real problem. Many schools don't have windows that can open. So there needs to be immediately a budget to ensure that windows can be opened, etc. And use masks where other mitigations are lacking. And next, fourthly, to provide resources, computers, Wi-Fi, study spaces, so that all pupils can study at home if this becomes necessary. We've seen increasing educational inequality, and the last thing we need is for that to increase any further. We know that interruptions with education at this stage of any pupil's lives can have long-term detrimental effects. So this is absolutely key. The government has committed to it. It's not yet been done. This is urgent. Fifthly, provide clear and consistent guidance on testing and self-isolation. This is needed for the pupils, it's needed for the staff, it's needed for the whole of society. And sixthly, ensure easy access to testing sites. They must be local. It's no good asking ill, infectious people to travel miles to get to a testing centre. There must be adequate testing slots so people can get this quickly, and the results should be returned within 24 hours. The speed of turnaround is absolutely vital in a functioning test, trace and isolate system. Thank you.
Thank you very much, Christina and Susan, for that update. And now we're going to invite some questions. And the very first question is from a 10-year-old, Spike. Spike, can we have your question, please? Hello, Spike.
Why is social distancing so important everywhere except in schools?
That is a brilliant question. Who would like to start with that fantastic question from Spike about social distancing in schools? We do seem to be seeing quite a discrepancy between schools and other workplaces. Who would like to answer that from our panel?
Well, I'm happy to come in, Spike, and to say that schools have people of all different ages, including teachers and other staff at school. And the older you get, the more likely you are to suffer from getting the virus. And so there's an argument that the social distancing is really, really important for people who are going to suffer considerably from getting infected. But we also know that children of all ages can transmit the virus. And so it's very important that social distancing be observed whatever age you are. So that's my view on it. And others on the panel may have a different or a more informed view. But my view is that it should be the same in schools as outside of schools.
Well, certainly we've already seen some photos from schools that have just opened this week, and photos of crowded assemblies where obviously there's no social distance happening. So it seems to be very different in different schools, with some schools really not able to manage it. Zubaida, you had a point to make there.
Well, first of all, I was going to say to Spike, you should be advising the government, because that's the sort of question that they should be asking as well, which is that social distancing should be just as crucial in schools as it is outside. Everybody needs to be protected, including all the adults in schools. That's teachers, that's administrators, that's cleaners, everybody. Now, what we said, Spike, in the summer when you were probably having fun, is that we recommended to the government that they should be more creative and create places and venues outside of school so that you could have smaller classes and children spread out much more. We know that buildings are very limited and the government hasn't done that, but there is still opportunity for them to use venues outside of schools so that you could still have social distancing. You could use other staff to have smaller classes. So thank you for that question, and hopefully the government will listen.
You're welcome.
Alice, we can't hear you.
Thank you very much. Thank you for your question, Spike, and I hope that answered your concerns. We're now going to go to Catherine Loch from TESS. Are you there, Catherine?
Oh, hello. Hi. Yes, I wanted to ask about the recommendations in the report on small class sizes. And I was wondering if there's any detail on exactly how small those class sizes should be to be safe. And also to ask whether there should be more social distancing in primary schools as well, and whether the government guidance on that goes far enough.
So who would like to answer that? I mean, at the moment, we have a situation, I think, in most schools where there's been no resources made available to secure more buildings or more teachers. So we've got regular class sizes in regular sized classrooms. But what size of classes should we be looking for? I wonder if you've got a perspective on that, Susan.
Sorry, just unmuting. Well, I think we have to go back to first principles with this, in that we know that the more people that any one person comes into contact with over a longer period of time at a closer distance, then the more likely one is to transmit the virus if one's infectious oneself, or to be infected if someone else is infectious. So we're also dealing with pragmatics. So I think it's how to ensure what's going to be acceptably distanced. We originally, the Scientific Advisory Group in Emergencies, said 2 meters. And that has continued to be shown much safer than 1 meter. However, that is probably not going to be realistic. So if it's mitigated with good ventilation, then I think 1 meter distance would work. But the ventilation does need to be good in those circumstances. And I think as well as government giving grants so that schools can open windows, doors, skylights, whatever they can, I think also pupils will need to get used to, and staff coming in with wearing more clothes. Certainly when I was a child, I lived in Edinburgh, no central heating, and we wore several jumpers in the winter. We also always washed our hands before meals without thinking about it. So I think we need to change some of these habits in order to accommodate the kind of new situation we need to be in.
Does anybody else want to comment on that issue of social distancing in the classroom, how important it is? Or should we go to the next question? Yes, Anthony Costello, would you like to comment?
Well, just to re-emphasize that this is an incredibly difficult situation. We want to get our children back to schools. Teachers are in the front line. They're the ones at risk, and the relatives of children. It's not the children. The children are going to be fine, particularly in primary schools. Yes, I think mistresses or masters or teachers have to try and maintain social distancing. I imagine that's going to be very difficult with primary school children, but we can do our best to do it. But the realistic, my primary school down the road has relatively small classrooms. There's 30 kids sitting in a class. It's going to be tough. So I was a bit worried when I saw those figures from Susan this morning in Scotland about the numbers of infections in schools. And we're going to have to watch this like a hawk in the next few weeks, because my worry is it's going to cause a lot more infections being picked up. Teachers are going to get very edgy, and we may have to face local lockdowns. So we're in a difficult position, and we have to show as much sympathy as we can with the realities facing teachers, but try our best. And that raises the issue, should we be following South Korea and insisting on all children to have masks, whether that would make a difference, and opening windows. Kids can survive a bit of cold, and they're going to have to, because ventilation is so important.
Thank you very much, Professor Anthony Costello. And I think that Christina Pargle would like to comment on this as well.
Yeah, just to say that, social distancing is important. It is really hard to do in schools, especially primary schools, as people have said. So that's partly why our first recommendation is driving cases down in the community. Because one thing that the evidence does show is that if schools reopen in a situation where there isn't that much COVID around, then basically it's fine and you can get away with it. It's when there's more cases around, and then it becomes an issue. So I think one of the things we can do is try and go kind of upstream and say, well, what can we do outside of schools to protect schools?
Thank you very much. We're going to have another question from the public now. We're going to Abid Zaman from Glasgow. Abid, are you ready with your question? I hope he's still there. We'll wait on Abid then, and in the meantime, Will Hazel, are you ready for your question? This is Will Hazel from iNews.
Thank you. Yeah, first question is, do you think that the current guidance on face coverings in schools in England, basically leaving this to the flexibility of head teachers, do you think that goes far enough, or would you like to see a more mandatory approach and perhaps mandating of coverings in the classroom as well as in communal areas? And just to clarify on that point, which Susan made about high risk indoor spaces, do you think pubs should close now?
Okay, so we've got two questions there. One about mask wearing in schools. Who would like to comment on that? Zubaida.
Thank you, Alice, and thank you, Will. That's a really important question. Sorry, I hope my mic's clear. It was astonishing that the Prime Minister passed the buck on this one to head teachers, as though, one, that they're scientists and they know the evidence, and two, that they have access to all the scientific evidence. This is an extremely difficult area. We ourselves have struggled to stay on top of the research on face masks. So to pass the buck to head teachers and give them the responsibility of deciding a very important issue like face masks was astonishing and not acceptable. I think Christina showed, and sorry, Susan showed us, and hopefully Susan can pick up this point about the pubs, as well as expand on this point about how the different schools across the country, sorry, and that was in Christina's presentation, how the different schools across the world are approaching this. And we've said as well in our presentation on Scotland, what we've learned from Scotland, that it does seem clear that where schools struggle with opening their windows with social distancing because the schools are too small, we do recommend that face masks should be brought into secondary schools in particular. But thank you very much for that very important question, Will. Susan, can I pass this on to you?
Stephen Reicher would like to come in on that one.
Stephen, you may speak.
Thanks very much. This is, I mean, the question of, I'll start with the question of other spaces, pubs and restaurants. The question of what we open first tells us a lot about our society and our priorities. And it's interesting to look at how people elsewhere in the world look at Britain. In Norway, for instance, where they opened schools before pubs and restaurants, they were bemused at what was going on in the UK. And they said, well, perhaps we're a society who cares more about our children than the UK. Well, I don't think that's true. I think we care about our children, but I don't think our values are reflected in the priorities that the government seems to have pursued. Now, pubs are now open and restaurants are now open. And I think closing them again is going to be problematic. But I think there are 2 points that need to be made. Number one, all public spaces, all pubs and restaurants need to have COVID safe practices, and they need to be monitored, and we need to make sure that they are doing all that they can. And if they're not, they shouldn't be open. And the second thing, and this is what we say in our document, is in high levels of infection, which we define as more than 10 cases per 100,000 people, 10 new cases per 100,000 people per day, then if that happens, then we should consider closing those spaces, because at that point, things can multiply and things then go into the schools. So I think we do need to be very careful, and we're going to have to make some tough choices, and it's going to say a lot about our priorities and what we like as a society as to whether we do that or not.
Thank you very much, Stephen. And we're going to go to another question now, which actually picks up on some of these themes. A question from Dawn Johnson. He's a parent of 2 boys, and she really is going to be asking on their behalf. So Dawn, are you there?
Yes, thank you very much, Alice. I am. My questions come about because we talk as a family about how we go back into sort of integrate into the public spaces. And my children have been watching me talk with my team about how we do that. We've spoken to the children a lot about how they found virtual learning, and they've gone back into school and come back. And their questions were, why has nobody ever asked us how we found virtual learning, what we gained from it, what we lost by being entirely virtual, and therefore what we needed to go back into school. So that kind of stop, start, continue strategizing process. And then the second thing that came out was, having been to school for the last few days, there was this sense that there was so much great information out there from WHO and UNICEF, and they could see that as a family we were working through that, challenging the evidence, deciding what was good or bad or could be justified. But there wasn't any sense when they were talking to their teachers or head teacher or amongst themselves that had actually been done, that information and evidence had been dissected either locally or nationally by the government to understand how to do this and minimise risks at both a local and a national level. So I suppose my 2 questions are, students are very important, they have a very strong voice, why haven't they been listened to? And then secondly, why in that same tone have we not taken the existing evidence and guidance that's out there and contextualised it at both a local and a national level?
Yeah, I think it's amazing that your children, your sons, have picked up on those discrepancies, and I think that those discrepancies help to create anxiety as well. Who would like to pick up Dawn's question there? Susan.
Yeah, thank you for those questions, both on this committee and also on the Government SAGE's Behavioural Science Advisory Committee. We've several times been stressing the importance of ensuring that all relevant people and communities and groups are really engaged in discussion, in problem solving, in coming up with the strategies that's going to work best for those communities. Because there's been too much top-down guidance without really engaging, listening to, partnering, consulting the relevant different communities, and pupils and families are really important parts of these communities. So sometimes we call it co-production or co-creation of the kind of strategies, the kind of guidance that will work. And there's really 2 reasons for going down the route that you and your family, your boys, and indeed us on this committee and on the Government SAGE committee have been really driving for this consultation. One is that we're going to get much better solutions because it's the people on the ground know what is likely to work, what are likely to be the barriers, what's going to be helpful. And secondly, it's going to be much more likely to be adhered to and implemented because people will feel a sense of ownership because they've been part of the group that have been producing this kind of guidance. So we have been saying really for the best part of 6 months to the government, please do more bottom-up working with communities rather than this top-down, kind of Westminster level communication only. And we'll keep repeating it, and thank you very much for giving us the opportunity to repeat it again. And I do hope some people in government are listening and might take it on board.
And Anthony Costello, Professor Anthony Costello, I think you've got a point to make here as well.
Yeah, this is my irate moment of the week, having watched the news this week where people were being told they had to travel 100 miles plus to get a nasal swab. We are 7 months into a pandemic. I've had 2 messages from GPs this week who are perfectly capable, or their nurses, of doing proper nasal swabs and far better than home swabs. One wrote, we've just been told to reduce care home testing in care homes, shortage of reagent in the wrong place, lack of direct access to national testing centres, and testing machine problems are some of the causes. The other one says test, track and trace is an absolute joke. with many patients not being contacted and quarantine checks non-existent as far as I can tell. A consultant colleague said low-paid factory workers are just ignoring it and going back to work after holidays in Spain and France. So we've got a fiasco. We've been presenting evidence for months about how contact tracing is failing and how the national testing system is failing. And we're not using our primary care system to collect the most basic investigation, a nasal swab, and sent through their courier system for testing. The whole thing is public health malpractice, and it's being designed and led by government ideology. They want to go a private system. It has failed, and we need to keep saying that. This is an independent view, by the way.
Thank you very much, Anthony. If you agree with that view, then the thing to do is to start lobbying your MP and to read the reports from Independent Sage. I know that Stephen Reiter, you've got a view on this as well.
Yeah. Well, I wanted to take the other half of the question, which was about the guidance that comes from other bodies like the WHO and UNICEF. And indeed, there's some very good guidance out there. And many of the points we make in our 6-point plan are consonant with points made, for instance, by UNICEF. So UNICEF stresses the need for small classes, and UNICEF stresses the need to, for instance, hire temporary spaces as a means of doing that. Now, that raises an issue. See, none of us are criticizing what teachers and head teachers are doing. They're doing a huge amount. They're trying to do their very best, but they can't do it on their own without support and without resources. To hire temporary spaces, you need financial support. To hire more teachers, you need more financial support. And for the government simply to hand it over to schools and to head teachers and say, you do it. You make people safe, you make people distance, isn't good enough. They have a responsibility to support the teachers, to give them the resources, and that simply isn't happening. So this needs to be a partnership between pupils, between schools and the government, and everybody's got to play their part. And the schools are playing their part. They're just being let down by the government, who's not giving them the support they need and they deserve.
Thank you very much. It's interesting, having discussed a bit around schools on social media. I've been contacted independently by a couple of schools actually who have been doing, Susan, what you were suggesting, which is to engage with their communities, to engage with parents and pupils, and to work together on plans for reopening. What's interesting though about those schools is that they don't want to go public with it because they're worried about being criticised by the Secretary of State. So we really need to have government supporting schools to do that kind of co-planning with their communities. Now, I'm hoping that Abid Zaman is back online and able to ask his question. Abid, I think you might be there now.
Yeah, can you hear me?
Yes, we can.
Okay, so are schools in Glasgow still safe given community transmission is now higher there? Also, would children possibly be transmitting it asymptomatically? Thanks.
So schools in Glasgow have been open for a few weeks now. Are they still safe? Who would like to comment on that? Christina.
So, I mean, there've been more cases in Glasgow, but as you saw from my report, the positivity rate in Scotland has been very stable for the last few weeks. So it's likely that a lot of that is testing. There might be some increase in transmission, but it's still quite low. So for instance, positivity rates in Scotland are still lower than they are in England. So I think, yes, it is safe to go back. And on children transmitting asymptomatically, that's definitely a risk. Like, children are much less likely to get symptoms of COVID than adults or young adults. And that's why you need such good contact tracing, because it means that as soon as you get a symptomatic case, you need to be on top of it and you need to understand who the contacts were and how it was spreading. And particularly for schools, that's why it's so important, because there is that risk of asymptomatic spread, which is really hard to spot. You're on mute, Alice.
Alison, would you like to comment on that as well?
Yes, thanks, Christina. And just to add, going back to schools, was that schools were really excluding a lot of children and siblings who had colds and coughs and sneezes. So we're seeing a lot of viruses as well. And the Scottish Government has just produced excellent guidance on the 31st of August on when children should be asked to go for testing and COVID. So it's really worth looking at that website and making sure that schools are really reading that guidance. And on a reassuring note, hospital admissions, as Christina was saying, are not only flat and decreasing in England, they are in Scotland too. And there are going to be some more adjustments to the data because it looks like the admissions are artificially high at the moment in the record. So I think there are lots of reassurances for children and parents at the moment. And I think it's really essential to follow the that schools look at the guidance and follow the guidance.
Alison, can GPs in Scotland do tests? Can they do local tests?
Yes, some of them can and some of them do. Yes, but it very much depends. But you're absolutely right, Anthony. There is an issue in some parts with access to the testing centres. And that's why the GPs are doing their own swabbing. I know in Midlothian, the GPs are doing it themselves because they don't want to inconvenience and send parents and children long distances for tests. And even if you can't get a test right away and they're sending you 100 miles away, it's sometimes that the slots become available an hour or 2 hours later, much closer to home. So I think that's another thing to look at. In the testing centres. But there is great variation in the policy, in practices and in GPs as well, and health boards.
Stephen, a quick comment there, if you can, before we go to the next question.
If I can say something about the Scottish situation, because I think it's really important to be balanced about this. We mustn't be alarmist. This is not a catastrophe that's going on in Glasgow. So, for instance, in the testing in Scotland from week 1 to week 2 of schools, the increase in number of children found positive was from 47 to 49, those aged 2 to 17. So we're not seeing a spike in infections in children. We're not really seeing much transmission in schools. Most of these cases are brought in from the outside. However, what's happening in Glasgow points to 2 really key issues of our action plan. The first thing, as Susan pointed out, is large numbers of children are having to go home and self-isolate. It's 20,000 children who aren't getting an education. And unless we have the IT, the Wi-Fi, the computers, the spaces where they can study, there's going to be an even greater problem of educational inequality. So that's really important. And the second thing, and this speaks to another of our action points, is that it seems that the reason for the increase in infections in the Greater Glasgow area is not due to house parties, it's not due to pubs, it's due to people having too many people round and not abiding by the restrictions. Now, these aren't bad people. These aren't people who don't care and they don't care about their children. But what we fail to do is to make clear to people that those types of actions add up and cause huge problems. And that's why it's so important to get the information out that you might think, well, does it matter if I have a couple more people round? Well, it probably doesn't matter if you do, but if everybody does, it aggregates and begins to harm our children. So it's really important to get that message out to everybody. Everyone's got to be responsible. Government, institutions, and also the public.
We're now going to have another question from the press, and it's Amanda Ferguson, who is a freelance journalist. Amanda.
Good afternoon, everyone. And again, thank you for this facility. It's very useful for independent journalists like myself. I just wanted to talk a little bit about, or wanted you to talk a little bit about the UK study that's saying children with gastrointestinal symptoms, about them being included in COVID-19 testing strategies, what your view is of that. And the second thing is, some of the schools in Northern Ireland have been back from about the 24th of August. And the feedback I'm getting from schools is that they can't afford the PPE that's required, that distancing is impossible because of the size of classrooms, particularly primary school children who physically need attended to, and that when to get tested is proving to be confusing, the information around that. I'm just wondering how much of a worry you think that is, and is it likely if the guidance isn't updated that if the classroom sizes are maintained as they are, will schools be empty before Christmas?
So this is a bit of a crystal ball question. What do we think is going to happen with the current setup? If we think that it is unlikely that new space and new teachers are going to be made available, if we continue with the setup that we've got, what do we think that's going to result in?
Yes, and also about that UK-wide study about the gastrointestinal symptoms, being included in testing strategies. Is that something that will be welcomed?
So let's start with that crystal ball gazing, and we'll go on to the gastrointestinal symptoms. Christina Pargle.
On the crystal ball, I mean, to me, it's still very murky. I don't think whatever happens, I don't think it's going to be driven by schools. I think it's going to be driven by other things going on in the community, and schools might amplify that. But I'm just as worried about people going back to work, universities, everyone going inside now that the weather's getting colder. And I really, really hope that our test and trace is up to it to stop it happening. But I don't know. I honestly don't know where we'll be at Christmas. In terms of the symptom question, I think Deenan's probably the best person to answer that.
Deenan, are you up to that one?
Yes, thanks, and really thanks for the question. And I think the context here is that a very small proportion of kids who get infected get symptoms. So there is a danger, and I saw the information, the data that came out today, and it was publicized and so on. And it's still from a relatively small number of children, the information. But I think the most important thing is to not overreact as we learn more about how this disease is manifest. Of course, over time, we will get more and more information, but both in adults as well as children. Why it's taken longer to get information on the array of different symptoms associated with the virus in children is precisely because far fewer children come into hospital. And in fact, I think in that study that talked about gastrointestinal symptoms, I think none of those children, from my memory of reading it, ended up in hospital. So yes, we need to be mindful of this and a wider array of symptoms, but at the same time, I think we just need to recognize we're quite early in understanding this, and the fact it's taking so long to get these sort of information out tells us that it's a relatively small component of all illness in children.
Thank you very much. Right, we'll go to let's let Carl Friston have a comment on that as well then. Carl.
Thank you. Just a very brief comment just to follow up on Christina's notion of schools as amplifying events. So it speaks to this context sensitivity, which I think is very important in terms of crystal ball and forecasting what might happen. And it's useful to remember that we do have a degree of control over what happens if we are sensitive to the context in which schools could amplify things. So if infection rates or incidence rates in Northern Ireland, say, exceed a threshold of 10 per 100,000, then there may well be license, and indeed some countries do actually recommend this, to reduce your class size from, say, 30 down to 15. Now, this is not going to have a material impact upon the children or their risk of morbidity or mortality, but it certainly will be a lever that will be operational in reducing the ability of that school to amplify the community transmission. So the crystal ball, the forecasting, I think, is made slightly easier if we are alert to the machinery that we have available that responds to the local incidence of infection. So I think this notion of schools as amplifiers, speaking to the risk to the community, is a very, very useful one.
How can children, or rather head teachers, get access to that information, Carl?
There's a regional breakdown, disaggregation of estimates of the incidence, by which I mean the number of new cases per day, at a local authority level, that can be accessed through the ONS. There's an enhanced breakdown for UK regions on our website at the UCL DCM website. So this is easy access. Within about 2 minutes of Google hunting, you can get that number. And what you're looking for, as Steve hinted at before, you want that number to be below 10 per 100,000, and then everything is okay to a certain extent. In the sense that there is nothing to amplify. If it's above that, then you want to go to your Parent Teachers Association, or want to shout at your MP, or go and have a chat with the headmaster and see what accelerated, context sensitive, walk up that ladder of mitigation options.
Could I just say, it might be helpful if we were to put a couple of those links on our website, because it might be easier for people to find through our website than the other websites. So I think we should look into that.
But do we have a feel for whether this is information which is being fed through to schools, or is it being left to heads to find out this information for themselves? Carl, do you think this information is being pushed out to individual schools?
It's a very good question. I do not know. No, it's not being pushed out, no. We have done implicitly our best to say this kind of information is out there, and it would underwrite a ladder of context sensitive moves that include things like, do you cancel PE? Do you now start to preclude mixed group work at school? There are all sorts of different measures which various countries, which we've actually put in an infographic. So the most recent 3-page school report actually has a little infographic with numbers on it, so that you step through or up a ladder as the community instance rate increases, and you can bring in new measures that are very similar to the 4-tier guidance coming from the UK government, that interestingly talks about at what point you might advise people to wear masks and in what situation. I think that these things are documented, and you can commit to a German model or an English model or the UK model. The key thing is they are driven by the instance of local infection. So we've made done our best to make that information available, but we haven't explicitly sort of pointed people to it. And perhaps Susan's point that perhaps we should make that sort of much more available. And there's an expectation that the head teachers and without worrying about being told off by Matt Hancock, that they should avail themselves of this information. Again, speaking to the importance of responding to your local context.
Thank you, Carl. That's brilliant. So hopefully there'll be links on the website then. And Stephen, you wanted to comment on that as well.
One of the first things we say in this report today is that this should be read in conjunction with the schools report. And the schools report, which is on the Independent Sage website, is very clear about this logic that there are set steps of mitigations you put in place as a function of the level of infection in the community. So anybody who's interested can go to the IndySage website, look for our schools report, and they'll find both the explanation and the underlying references there.
Brilliant. Thank you very much. I think we've got time for one more question, and it's Tom Magner from Carers World. Tom, are you ready with your question?
I am. Thank you very much indeed, Alice. Hope you can hear me. Young carers in our audience, and for that matter, adults as well, are telling us they're worried no one's talking about pollution and COVID-19. The fear is, they say, that with winter coming, that smoke from neighbours' bonfires and wood-burning stoves will make breathing difficulties worse, possibly risk more severe COVID-19 symptoms if they're contracted. As far as we can see, official government policy and the industry say it's fine to burn wood as long as it's dry and seasoned up. So who's right scientifically, the official thinking, or our viewers who by and large are saying people shouldn't be burning wood at all?
Quite a complex question where...
Sorry about that.
with environmental issues. Does anybody want to comment on that? Yeah, Christina.
comment specifically on wood burning stoves, but I have seen that there have been a few studies showing that people have more severe COVID in city centres where there's a lot of air pollution. So it does seem that if there are other things that are already affecting your lungs, I mean, it makes sense that then if you get COVID, it might be more severe. But I'm afraid I can't say much more about the wood burning stoves.
Yes, Susan.
I mean, on the issue of air pollution, there's also the issue that private car use is increasing. And it obviously went down massively when we were more restricted. But people who were previously taking public transport are now tending towards private transport because of worries of transmission on public transport. And this is a real problem in terms of air pollution and the climate emergency, which has not gone away during COVID, even though it's not been in our press. It's probably a greater existential threat to humanity than this pandemic is. So I do think it's really important, the point you raised, that we do need to think in a joined up way. And again, this needs to be driven by government policy to ensure that public transport is such that people can feel safe, that there will be distancing, there will be the disinfecting that's needed, and also that city centres be replanned to encourage walking and cycling. So there's a phrase of build back better, which I think is really important. We've lost so much in many different ways through this pandemic. We should think about what are the positive things that we can build on to make society more equal and better for everyone.
Thank you very much. Deenan, a quick response if you can, and then we'll have a final question.
Sure, thanks, and thanks for the question. A couple of just observations. In fact, wood burning stoves have actually been trialed, as and there's been sort of formal studies of this, mainly outside the UK. I'm familiar in Malawi, for instance, a number of studies that have demonstrated that they don't necessarily increase overall lung dysfunction. That's just an observation that. But the other aspect of the importance that you raise is that we are learning all the time about the long-term consequences on the body of coronavirus, and it's clear that there's what's called a long tail. There's a lot of thought that, of course, the severe lung damage that happens even in those who are relatively mildly infected may, of course, have long-term consequences, susceptibility to other infections, and therefore susceptibility to the adverse effects of smoke. So I think all of these things are really important. How that affects, I think it's very difficult to say now what should given advice, what should or should not be done, but it's something that we need to make sure is studied.
Thank you, Dean. And before we go to the final question, we had so many questions coming in via social media, and particularly Twitter. And there were quite a lot of questions from parents who were really concerned, in particular about children with special educational needs and disabilities and or medical conditions, asking about what additional support exists for those children and what monitoring might be in place as well for those children. And I think it seems like a quite complex question, but I wonder if there's anybody who could offer a quick perspective on that. How we look after those children who may be more vulnerable within our schools.
I think the simple answer is that if a child is under their GP or a paediatrician, they should discuss it with them and to see how, because there are such a range of conditions here. But I thought you were going to say, Alice, this is a topic that maybe we should take up and think about with a report, perhaps with some of our paediatric colleagues. And I'd be happy to talk to the Royal College of Paediatrics about putting together a simple report about that. But the best advice is that you go and talk to your local GP and or your paediatrician and get some good advice that will suit your particular child's needs.
I think that'd be amazing if all of you could get together and focus on that in a future report. Zubaida.
Thank you. My response is less medical and more to do with the fact that the other issue that this raises, which was mentioned by Susan in terms of what we're learning from Scotland, is the high number of children that are having to self-isolate. So it falls into the same category as vulnerable children who are likely to be in and out of school. Now, what that raises, the extremely high number of children self-isolating and vulnerable children who might need to be in and out of school, is the whole issue of digital online learning and whether children, particularly in deprived areas, have access to that. Now, I want to very quickly share some figures with you. Back in the summer, the Department for Education promised 200,000 laptops and 50,000 routers to disadvantaged Year 10. The Children's Commissioner got the data from DFE, and guess what they found? They found that only a third of academies had received fewer than 10 laptops for all their Year 10s, and only 27 academies had just received a single device. So the issue this raises is that how wholly inadequate the provision for online or support for online learning for disadvantaged children has been, how DFE has promised to fill that gap and they haven't. And we know that that educational disadvantage gap has grown, but it's only likely to grow more in the next couple of months, because we know children are having to isolate, we know vulnerable children are having to go home. If there's outbreaks, once again, children are going to go back home. So that does raise very important issues. And at the moment, that's been wholly inadequate and needs to be readdressed by the Department for Education.
Thank you, Zubaida. In the last couple of weeks, we've heard a lot about moral responsibilities and the moral responsibility of parents to look after their children, but I think the DFE needs to step up its own moral responsibilities. We're pressing at the edge of our time now, but I'm going to allow one more question. It is from Morag Spencer. He's an ICU nurse. Morag, I hope you're still there with us.
Yes, I am. Thank you. I just want to know, at what number of new cases in my local area do I consider removing my kids from school?
That is a very good question. Does anybody have an answer for Morag? At what level would you consider that, Susan?
Well, I would say it depends, because I think what we want to do is keep children at school as long as we possibly can, because the next generation's education is one of the most important things. But in considering the question, one of the issues is the level of community transmission, and the other is what's going on inside schools. So I think if the school practices are good, if there's the social distancing, the hand washing and hygiene, the ventilation, and the procedures are really being adhered to, and there aren't big outbreaks that aren't being dealt with within the school, I would say keep them there at school. But I think there's a number of factors. And also the other thing is I wouldn't think about doing it on your own. I would contact your local public health in your local authority and do that collectively as a parent's body to really get locally informed professional advice as to what the best strategy is.
I'm just going to interrupt. I am in regular contact with the Surrey County Council. It's Ruth Hutchinson, and unfortunately she's not giving that information. So what I can say is, Surrey, you can see that they are issuing warnings, like they've just issued a warning for Elmbridge, but I don't know at what level they're issuing those, and they're not releasing that.
Okay, so very quick responses now, please, from Carl.
So a quick response, the level where you'd start to want to see action is 50 new cases per 100,000 per day. As a mother, you shouldn't be particularly worried. So this is not risk to the children, but as a nurse responsible for the community, that's where you would expect to see regional responses, in terms of restrictions and lockdown. If it's not happening, you need to find out why.
And Stephen, I think you wanted to comment on that as well.
Well, to echo Carl and to relate it to the last question, I think it's really important to have a balanced perspective on schools, not to be alarmist, but to recognise there are issues and problems. By and large, children are safe, and by and large, children are not going to suffer. However, schools might have an impact on more general community transmission. And again, there are simple ways, simple mitigations which work against that. And that's what we've tried to do in this document, in our 5-point plan. So the best way to mitigate against anxiety in children is to make clear to them they're safe, and then to mitigate against anxiety in parents, to be clear about the steps we can take. And if those are taken, and if everybody, including government, takes their responsibility, then I think we can allay the anxieties which are very widespread and understandable and being expressed today.
Thank you very much, Stephen. I am going to draw things to a close now. We are slightly in excess of our hour, but it's been an amazing discussion with lots of very, very interesting questions, and I hope that those answers have been useful. The full reports are available on the website, so please look at the Independent Sage website and follow Independent Sage on social media as well. So look them up on Twitter, and we'll keep you updated with new reports and what we're going to be covering in our weekly briefings there as well. And thank you for the questions. Thank you particularly for 10-year-old Spike being so brave as to come on this live briefing. Thank you, Spike. And I'm going to hand over now. The last word belongs to Sir David King.
You're mute, Dave.
The last word was going to belong to Sir David King. Now it is.
Thank you very much, Alice. Once again, we've seen the value of an open, transparent science advisory system. These public meetings are an exchange of information between the experts and those that we are addressing in the public domain. And that has two functions. One, it is a real exchange of information. The second is, hopefully, it creates trust between the experts and the public. What I do want to just comment on very briefly is something that we have been working on, as Anthony said, for 5 or 6 months, which is the failures of the government to respond in a proper way to this amazingly important emergency. So what the most recent failures are: the failure of the government to use the summer to head towards zero COVID. That has been a very serious issue, because as we go into the winter months, frankly, we're not saying we can predict that we're going into a second wave, but we can say that the risk of that is now much greater because of the level of infectivity in the country, and in particular, the level in some parts of our cities. So we really are approaching opening schools and opening universities in a situation that is more risky than it would need to have been if, for example, we had just kept the pubs and restaurants' indoor activity out of play for another 3 or 4 weeks. We would have brought the infectivity level in the country down very much more substantially. I think as well, I cannot let this pass without commenting on the total failure of the government to deliver a find, test, trace, isolate and support system that was fit for purpose in an emergency. Imagine in an emergency if all the hospitals had been closed down and we had simply built up private sector hospitals to deal with the new arrival of patients. Instead, what we saw was hospitals producing an amazing response to this tremendous challenge to their system. The public system did operate. We should have been using the healthcare system in its normal usage, but with much more finance, to run the test and trace system that we feel should have been local. It should have not been given to private sector, new private sector companies without healthcare experience. Now, the government is boasting that they have created the fastest developing new private healthcare systems in the world. This isn't a boast that is worth boasting about if it is costing lives, as we are saying it is. So I think I'm just sounding off, as Anthony did, because we feel we are doing a good job here. I've got an amazing group of people around me, and we don't get enough response from the government. So I think I leave it at that. We will continue with these weekly public meetings, and I hope that the public continues to listen. But an even bigger hope would be a turnaround by the government so that they listen too. Thank you.
Everyone, we'll see you again, same time next week.